user, a participant in a clinical study. I want to log in, and here's my dashboard. Um, this is a summary of my stats. I'm new, so there's nothing there. And of course, I have no transcripts. I haven't done any personalization. So this is empty, but I have this set of progress that would guide me through the setup steps. The first step is to fill out the pre-survey. So I'm going to click the pre-survey, and shows me a form where I can consent to the study. It asks me some questions about speech recognition and typing, and I just have to fill this out before I start. And then job satisfaction, let's say 6, and I submit. So step 1 is done, the pre-survey is complete, and then the next step is to capture my current documentation speed. So how long does it take me to type notes without speech to text? So we use the baseline feature to complete a few notes. So to complete this part, I have to type in a note. Let's assume I'm seeing this patient and I had to type this text, and then I have to record the time the patient arrived in the hospital in the morning, let's say 8:05. Let's say I started seeing them at 11:15, and then I started typing my notes at, let's say, 11:25 after discussing with the patients, and I finished typing this notes at, let's say, 11:35. So it took me 10 minutes to just type, let's say, 2, 3, 4 paragraphs, whatever, and then this patient left at 11:40. Okay, so I log my documentation time, the visit time, without using speech to text, and I submit. All right, so um, I can then copy out this note and paste in my EHR software. So I have to do this for a few notes so that I can record my documentation time. I clear this and I start again. So let's say I have another note this time that's a bit longer, and I already have some pre-set text here. I paste it in. So this is a fairly longer note. You can see this might take me like God knows how long to take. So this patient came in. Let's say they came in the morning at like 8:30. I started seeing them at, let's say, 12:45, and then I started writing my notes after examining the patients, asking for a history, and let's say I start my notes at, let's say, um, 13, um, 12 or something, and then let's say it takes me almost 20 minutes to type this long note. So let's say that's 20 minutes is 32, and of course the visit ends quickly thereafter. Yep, let's just put it that, and then I submit, and then I can go copy this out um, and paste it in the EHR. So this way I log the amount of time it takes me to see a patient and the amount of time it takes me to type a note, depending on the length or the complexity of the note, basically. All right, so I've done a few baseline notes, and you can see I've completed the baseline steps. The next step is to do some personalization. Basically, I want the application to understand my voice and to have improved accuracy on my voice, basically. And so it presents me with a sentence. I need to hit record and then read this out in English. So by reading these sentences into the application, it starts to learn my voice and how to transcribe better. So I hit record. Non-displaced fracture of intermediate cuneiform of left foot initial. Injectable injection kinelytic urokinase 250,000 IU per vial, non-displaced transverse fracture of shaft of right radius subsequent. All right, so I can review that. It record non-displaced fracture of intermediate cuneiform of left foot initial, injectable, injection, kinelytic urokinase. All right, so that sounds about right. So I can submit and go to the next sentence. Other specific joint derangements of right elbow, not elsewhere, class C. Capsule, oral cyclopar, tetracycline hydrochloride 250 milligrams, congenital deformity of fingers and hand. So I stop, I can review again. 250,000 IU per vial, non-displaced transverse fracture of shaft of right radius. So that doesn't sound right, so I can actually delete that and redo this. So you can correct yourself if something goes wrong. You can delete and repeat a sample. Presence of artificial limb, complete, partial, unspecified. Capsule oral phentermine hydrochloride, 30 milligrams, non-Hodgkin's lymphoma, unspecified, extranodal and solid organ sites. Stop. Presence of artificial limb, complete, partial, unspecified, capsule. So that sounds correct, so I can submit. I go back to my and I see I've completed the personalization step by dictating a number of minutes. And finally, the next step is to go ahead and transcribe. And I want to complete a few transcripts as part of this of the study. So I hit transcribe. This same interface, I can read the instructions if I want to. And so, patient presented with fever, cough, and breathlessness. Patient had a history of hypertension and diabetes and coronary artery failure. So this transcribes the notes, and I can also log the visit time like I did for baseline. I just want to record a few samples. Diabetic patient presented to the emergency room on account of 5 days history of pain, numbness, and breathlessness, whatever. And the idea is I'm in clinic, I'm seeing a patient, I have a note, and I'm writing that note. I'm dictating instead of writing that note. And when I'm done, I fill out all these details. After I've done a few practice runs with this speech transcription tool in clinic, seeing a few patients, maybe 10, 20, 30, 40, whatever. See that I'm now at the fourth step and final step of the study, which is to fill out the post implementation survey. And so I have the same form, consent, level of comfort with speech recognition has increased. My perception of the accuracy has also increased. Typing speed is still the same. Level of awareness, I'm now very familiar, and my job satisfaction, maybe it's better now, maybe it's an 8. I submit this, and survey entry successful, and it says congratulations, study is complete, and I can go ahead and enjoy the transcription app. So I can go back here and transcribe a few notes without needing to enter my study details, my visit details anymore. Since the study is now over, I can use this to dictate a normal note for a patient. that's it.